Now, look, since this is such a sensitive topic, I need to put this disclaimer up right quick. Let me bring a disclaimer. One, the information that's broadcast on this show tonight is provided for educational and informational purposes only and is not intended or implied to be a substitute for professional medical advice, diagnosis, and treatment. Also, we don't have a other disclaimer, but with that being said, according to the CDC, Blacks and African Americans are 3.7 times more likely to be hospitalized from COVID and 2.8 times more likely to die from the deaths of COVID. It seems like race and ethnicity are risk factors for other underlying conditions that affect health, including socioeconomic status, access to health care, and exposure to the virus related to occupation, frontline, essential, and critical infrastructure workers. Now, with that being said, let me just say this. I can see why African Americans are at risk. I'm just going to be straight with you. Yesterday, I went to a package store in Baltimore. And for those of you who don't know what a package store is, liquor store, wine and spirit, however you want to frame it up, a store where you buy alcohol. However, there was a bar club connected with this store. So when you walk in the store, you can go straight and go into the restaurant where the bar is, or you can go into where the liquor store part is. Do you know that people, I was able to see in there, and there were people with no mask on, touching on different machines. Some had masks, but some didn't. So I can see, because one of the risk factors is being in a crowded place. And that's where a lot of minorities are. It may be in a crowded condition, whether it's home, work, infrastructure, out partying. This is real. So, without further ado, I'm going to bring on Dr. Webster. She's going to help me unpackage this from her point of view. And let me just also say that this show isn't about taking or not taking the vaccination. I just want to make that clear. But it's an information and educational show about the virus and vaccine that you can hopefully make an informed decision whether you want to or not. It's everybody's choice. Just like people working on the front line, doctors, nurses. It's their choice if they want to take the vaccination or not. And we always had that choice. When I worked in dialysis, you had the choice of taking the hepatitis vaccination or the flu vaccine. That was your choice. So without that being said, I'm going to give a special introduction to our VIP guest. Without further ado, Dr. Webster. Hey, Dr. Webster, how you doing?
Hey, Steve. How you doing this evening?
All right. We gave you that special introduction again.
Thank you. I appreciate that. You're awesome.
Great. And again, thank you for taking the time out of your busy schedule to come on World Kidney News International. Very, very much appreciated.
Thank you for having me. It's a
So,
pleasure.
great. So, Dr. Webster, before we talk about COVID-19 in the minority community where you take the vaccination, can you just give us a brief synopsis of your education and what brought you here tonight?
Sure. I'm a doctor, so I'm a medical scientist. So as you can see, I have my MD and my PhD, and I studied virology and immunology, and HIV studies was my concentration. I'm also a family medicine physician and a flight surgeon in the United States Air Force, and being a minority and having close family members, unfortunately, that were diagnosed and have died from the COVID-19 virus with a lot of my family members in New York, which is definitely one of the hot spots. This is very close and dear to my heart.
Wow. Wow. All right. All right. My thoughts and prayers to you and your family. Wow.
Thank you.
And also, thank you for your service, Dr. Webster.
Thank you.
Absolutely. Flight surgeon. Wow. So you've been riding on helicopters.
Helicopters, fighter jets, helos, heavies. I've pretty much done them all.
So have you ever, do you ever get nervous when you're riding on any of those flights?
No, it's an adrenaline rush.
I can imagine. I can imagine. So let's talk about the virus. I mean, we know all the information has, All right, you still there? Okay.
Yes, I'm here.
All right, there you go. So your camera is going in and out.
Oh, I'm sorry. Let me get back in here.
All right, great.
Can you see
great.
me? I'm sorry. Okay.
Absolutely. So about the virus, I mean, it's been about a year, not quite, but I mean, it's probably been out even sooner, but we didn't know about it. A lot of shows, people opinions. I mean, it's a lot of information out there, but let's just talk about the virus and get the basic information of this virus. What is the COVID-19 virus and how is it transmitted?
So yes, thank you. So COVID-19, COVID-19 is the name of the disease, but the actual name of the virus is SARS-CoV-2. So SARS-CoV-2 is actually severe acute respiratory syndrome, coronavirus 2, because SARS-1, remember back in 2003, that was the first, but now it's just a second version of SARS-CoV-2. And pretty much the transmission is exposure through respiratory droplets. And now respiratory droplets is what actually carries the infectious virus. Now there's different sizes of respiratory droplets. You have the very large ones and you have some small ones, or you call it very small particles. Now the large droplets within 6 feet or less, you can actually see those droplets like come out of your mouth, right? When you're talking, when you're sneezing, when you're coughing, when you're singing, those droplets actually go as far as 6 feet. So that's why they want you to stay at least a minimum distance of 6 feet apart with people. But you have small particles, or you call aerosolized particles, that are very tiny. And if you talk or you sneeze, those things could travel a great distance. That's why they want people in crowded areas, in confined spaces, because those could travel greater than 6 feet. Larger droplets, seconds to minutes, they will fall down on the ground. But then you have the larger, the small microns, they could travel in the air for hours, maybe in days. And these things could also drop on surfaces, right? So it's not just if somebody coughs or sneezes on you, but it could, if somebody sneezes in a hand and then touch the door, like the door is called like a fomite, you have a vector right there, you can pick it up as well. So that's why, good hand hygiene, using good, say mouth etiquettes with sneezing, coughing, covering up, but then also wipe it down surfaces as well, because it can carry on surfaces, some for days. I think some studies have shown me 21 days on surfaces. So you have to be very careful of that.
Wait a minute, you're saying that the virus can last up to 21 days on surfaces?
Yes, some studies have shown that. That's why you
Wow.
have
I mean,
you
that's
have
more
to
than
clean.
HIV and hepatitis B. That's
Yes,
like
yes,
7 days.
yes, yeah. So it based on certain conditions, and now that it's cold, it could definitely survive a lot longer.
Wow. Wow. Now, what are some of the classic signs and symptoms of COVID? I know there's been a lot, and I know,
Hmm.
I mean, it almost seems like every time you hear about another sign or symptom emerging that's taking over another sign and symptom. So, what
Yes,
would be the most classic sign and symptom for one to say, I need to go seek medical treatment?
yes. So before we go into the signs and symptoms, I want people to be aware of their local resources. So every state has their own state department of public health. The CDC has a website as well, which is the Center for Disease Control and Prevention, and the WHO, which is the World Health Organization. They all have websites and resources in terms of signs and symptoms and when you should see your medical doctor and seek medical advice immediately. And there's two sets of questionnaires that you could type in your symptoms, and they would say yes, go to your doctor now, or you can kind of like watch or call your doctor. But the most classic symptoms you hear on the news and in the data and the things you see actually in the clinics is fever and chills, right? Cough, shortness of breath, difficulty breathing, fatigue, muscle ache, joint pain, headache, a new loss of smell or taste. You may get a sore throat, you may have some congestion, you may have a runny nose, and you may have diarrhea, you may have some vomiting, some nausea. It's a lot of things we're so used to with the flu, right? It's very broad topics, but when you talk about like emergency symptoms, like no kidding, seeking medical help immediately, that's when you have like truly difficulty breathing. Like you take a few steps and you're out of breath, something very unusual in your normal daily routines. If you have a persistent pain or pressure, in your chest, definitely go see the doctor. If you have like confusion, you're not as alert, things seems kind of hazy, definitely seek help. Inabilities to wake up or stay awake because you're so fatigued, right? It's just so out of it. You call like lethargy, or somebody like shaking you and you just can't stay awake. uh, Definitely seek a medical attention. And if you have like bluish lips, or bluish face, meaning like you're not getting enough oxygen, it affects
Okay.
our lungs, you definitely should see medical attention immediately.
Wow. Wow. Now, I know there's certain times after exposure one may or may not have the symptoms, but when do symptoms normally occur after one has been exposed to the virus?
So that's a good question. So for coronavirus, they say it takes anywhere between 2 to 14 days before one could
Wow.
show symptoms if they're symptomatic, because you can have it and be asymptomatic and still transmit it during that period of time as well.
Wow. So you can have the virus and not even, and like you say, be asymptomatic, meaning not having symptoms for people. We're talking medical jargon, but that means
Yes.
without having any symptoms. So
Mm-hmm.
you don't have any symptoms, but still transmit it. So
Yes.
as
Yes,
so
sir.
as I talked about yesterday when I walked into that store and saw the people in the bar, it could be someone in there that could be passing that virus on and no one doesn't even know it.
True. Very true, Steve. Very scary thought.
Wow. And and okay. Wow. Wow. And so how long? Well, you said about 2 weeks to
Two
21
days,
days from
two
two
to
days
14 days.
2 to 14 days.
And that's why we
Wow.
ask people to quarantine themselves for 14 days to give them enough time, if they are symptomatic, to show the symptoms. And then when you are symptomatic, seek help, and you stay quarantined until the infection has resolved.
Hmm. And I'm sure, can this virus obtain to people that say everybody is different, where you got some people that may be healthy that die from the virus opposed to some people who may have been sick that recovered? Can you
Yes.
say that everybody is different on the way they respond to the virus?
Yes. As I said, every case is different. We're still doing a lot of research to determine, which subgroups, but we know for sure that our elderly population, ages 75 and above, are at the highest risk because they're the highest percentage of hospitalizations. Up to 25% of them are hospitalized, even though they're only 8% of the population. Also, you would say people with comorbidities, people with diseases like heart disease, diabetes, any underlying conditions, you get cancer, you get immunocompromised. Those people are also susceptible to getting the COVID-19 virus. So, and then also, even though the highest numbers we see are in young adults, it's just that a lot of young adults are healthy and don't have other health conditions. That's why this death rate, you don't see that much of a death rate versus the elderly. As as you get older, it'll get a lot more complications of ailments. They are at higher risk, especially people with a kidney disease, right? And people on dialysis, or people who are on transplants or receive a transplant. They're also immunocompromised. So it's very important for them as well to be aware of their surroundings and they really isolate themselves because they are susceptible to the virus as well.
Sure. Let me ask you, if one feel like they've been exposed to the virus, when should they seek medical attention? I know you talked about the classic signs and symptoms, but should one, if they feel like they've been exposed and have mild symptoms, should they still seek medical attention, or should they just what's the word? Stay in place. Yeah, weigh it out until the symptoms get worse. I mean, when should they seek medical attention if they feel like they've been exposed?
That's so hard, right? So, as a physician and as a mom, a sister, a cousin, especially within our minority groups, it's unfortunately a lot of us, young and old, have multiple health conditions. It's something as simple as asthma. That is an underlying medical condition. People don't realize that if you take medicine for anything, you have an underlying medical condition. So, and since we're already in a season of flu and coronavirus, you should seek medical attention immediately and to get tested or go to public health and then get testing. It's free. It's free testing. So go see your doctor, go to the public health. They have, I know here in my community, usually every couple of days in the week, they have testing sites for you to go to. So, and even they have home test kits that you could buy online. So if you have a question, just get tested. It's that simple. And if you're negative, great, but still be cautious because a lot of times people don't get the results right away. And during that period of time, like waiting for results, you could be asymptomatic and still passing on to somebody else. So just be careful and to just assume, okay, I'm negative. But you just have to be careful because other people may be still susceptible to it.
And I'm glad you said they have, online kits because at least people know, online kit, you can put the swab up your own nose so you can determine how far you want to go up, like ease it. Whereas one of them people, when you go through the line, they shove it, almost like you're on a factory assembly line because they're trying to get so many people through there. So that's good to know. That is good to know. Let me ask you, the flu and COVID-19 kind of mimic each other. I mean, what are the difference between the flu and COVID-19?
That's a very good question, Steve, especially now since we're going into the winter season and this is the time we typically see flu. And this is when we tell people, get your flu vaccine. So that way people aren't getting confused too between COVID and the flu. But they're very similar. Like I was saying before, that those classic symptoms, you see those very same symptoms with the flu. And then because influenza and COVID-19 virus, they both are respiratory disease viruses. They both are transmitted through respiratory droplets, right? Also through close contact. And it also with, I said like fomites, where you have virus that's on surfaces and you may pick it up by putting it in your nose, your mouth, or rub it in your eyes possibly. So in that sense, that's why I said good hand hygiene and then just good respiratory etiquette when you're coughing and sneezing, in your elbow. That's very important. But the difference is really is the speed of transmission. So a lot of people think that COVID-19 transmits fast, but influenza virus actually transmits much faster. It takes within 3 days of a person being in front of you, and you've seen necessarily like the symptoms of that. The speed of transmission is 3 days, versus for COVID-19, it might take 5 to 6 days when you're in contact with that person. And the time between the infection and appearance of the symptoms is a lot shorter for influenza. So you could actually, somebody could sneeze on you, you could get sick within that 24, 48 hours. You actually could transmit it to somebody else before you even start showing the symptoms of it. So that's the scary thing with the flu, is that, you sneeze on me today, I get it 24, 48 hours later, I could transmit to you for the next 2 or 3 days before I even start showing symptoms. Versus with a COVID-19, as they say, it takes 2 to 14 days. You may see the transmission between 5 and 6, and then by the time you try to transmit it to others, you're already showing symptoms. So that's the one tricky part about the flu, that you can have it, be asymptomatic, but then later on become symptomatic. But during that period of time, you're transmitting the virus. Mm-hmm. And then also a big major difference too between the two, that in terms of vectors, is that children for the flu are our biggest, our petri dishes, right? You said in schools and in daycares, and the kids are stuffing nose and hug and kiss each other, right? They're the major vectors for transmitting the virus to others. But with COVID, it's actually the opposite. It's adults that actually give it to the children. So the young adults are the one who transmit it, versus the other way around when you have, with an influenza virus. So that's one thing, that's a difference in terms of like the speed and transmission. But another thing though is that with COVID-19 is that they could spread to more people, versus influenza is less. So they show about, you could spread, one person could spread to 2 to 2.5 people at once, versus influenza is actually less than that. And then in terms of the severity, a lot of times with disease, and unfortunately, with COVID-19, you may have 80% of people who may get the virus, but it may be asymptomatic or mild. But you have 15% of people with COVID-19 that has severe infection, which means they require oxygen. 15%. Wow. And 5% are critical, which needs the ventilators. Now, between severe and critical, people who need oxygen and then ventilators, with influenza, it's only 0.5%. That's a huge difference. So even though influenza, it transmits quicker, but it doesn't transmit to as many people, and it's not as deadly in a short period of time. Of course, it's still new. We're still, tracking this virus, but in the period of time we've shown that it could transmit it more, and then during that period of time, those people, it could more be hospitalized and most likely need a ventilation.
Now let me ask you this. Something just came to my mind. If one was to get the vaccine, the COVID-19 vaccine, would you still have to get the flu shot? I mean, does it cancel out? Like, I know they're two different viruses. So if you got the COVID, it's just potential against COVID. It won't do nothing against the influenza vaccine.
You're exactly right, Steve. So they're two different viruses. They have two different types of vaccines, two different modes of actually creating a immune response. So you would have to get each vaccine to protect you from either virus. But even so, even if you like the flu vaccine, you can still get flu. But if you do get the flu, the symptoms are less. Just like the COVID-19 vaccine, if you had a vaccine, it's actually the probability if you do get COVID, then the symptoms are less. So that's why they recommended people who already tested positive for COVID-19, who actually, I guess, had it and then recovered, they still recommend those people to get the vaccine as well. So even if you had the vaccine, you was COVID positive and you recovered, you still recommended to get the vaccine.
Sure. All right. Now, Doc, why does COVID-19 impact the minority populations at such a high disparity rate?
And that's a very good question. And I would say that COVID-19 has opened up our eyes in terms of the healthcare disparities we have in our nation. So when we were talking earlier about underlying conditions, as far as minorities, in terms of our percentage, it's a lot higher than any other ethnic group. So we are at a high susceptibility, like you're saying, like a 3-to-1, because we are more likely to have diabetes, hypertension. But why are we more likely to have diabetes or hypertension? It's because the access to care is less. The amount of care we get is less. The exposure we have in terms of our healthy eating. If you go to these ethnic neighborhoods, how many fast food joints, liquor stores, they call package stores, how many fast food joints you have in that neighborhood, how many grocery stores are selling you non-processed food versus produce, healthy produce straight from the farm. So because we call a systemic racism that's transcended over a century, centuries actually in the United States, it shows the underlying cause is being different socioeconomic statuses. Like you said, we live in infrastructures, we live in co-ops and buildings and stuff like that were very small, right? You may have 10 people in a 1-bedroom apartment. That's not unlikely. You have people who have work in not the best conditions. The people were, like you said, like we're closer together and we may not all be wearing masks, which we should. And so it's a combination of things. It's just the socioeconomic status, the infrastructure where you work, where you live, medical conditions, your access to care, and the type of care that you get, and the lack of trust in the care that you get. All that culminates to why we as a people are getting hit the hardest with this COVID-19 virus.
Right. Now let me ask you, let's talk about the vaccine now. Can you tell us just a little bit about the vaccine? How was it made so fast where it usually take about maybe 10 to 15 years for the development of a vaccine? How was this able to and I guess that's why it's a little mistrust in some people in taking this, because it was developed so quickly. How is that?
So in terms of, we had during Trump administration, we had the Operation Warp Speed, right? So we were getting all the top scientists and everybody come together to find a vaccine. Because it was such a huge pandemic, that means it goes across the world. We had everybody, all the nations, the top scientists across the world trying to get a vaccine because of the effects it had pandemically and economically. But the thing is, this vaccine development didn't just start this past few months. As I was talking about it, COVID-19 is a form of SARS. So, it's SARS and MERS. So, MERS was the Middle Eastern respiratory virus. So back in 2003, we had the big outbreak of SARS and then MERS. That started research back in 2003. So vaccine development that's been happening for years, but we don't hear about it until things hit the fan, right? And then things in the media puts it out there, right? Pop off. But as scientists, we're always doing research. Cancer research, HIV research, different virus research. Bacteria, parasites. It's always research being done with different pandemics or epidemics that have in certain areas. But since COVID-19 came out and it's a form of SARS, we were able to have an expedited kickoff because of that. So that precursor actually helped us confine our time. So it wasn't like the vaccine was just developed in a few months. Of course, that's a lot of red flags. Like, how safe is it? But this is actually a vaccine that's been in the works for a long period of time, and just that we changed the component because it's an mRNA, so virus. So instead of taking the SARS MERS component, we just took the SARS-CoV-2 component, put it in a vaccine, and they're able to go in trials. So that was already developed. So that's how he was able to do phase 1, phase 2, phase 3 trials, because the vaccine was already developed for those older viruses.
Okay. Okay. Wow. Interesting. Very, very interesting. Doc, let me just ask you from a medical doctor point of view, why do you think there's a lack of trust among minorities in taking this vaccine? But on the flip side of that, the minority community, ethnic community, is at greater risk and disparity and are the ones that are dying at a higher rate than the other community. So it almost seems like it's like I don't want to take it, but at the same time, that community is dying at a faster rate. Why is it a lack of trust to take a vaccine that could possibly save your life?
And then, unfortunately, it's based on our history here in the United States. Everyone
Sure.
remembers the Tuskegee experiment back in Alabama, that went on. The U.S. government did these secret testing on our Black males in Alabama for very deadly venereal disease, syphilis. And then that study was going on for over 40 years, from 1932 to 1972. So for over 40 years, we were studying Black men with a disease that had a cure with penicillin. That it first came out, penicillin been around since the 1920s, but when it first came out as a cure for syphilis in 1943, imagine from 1943 to 1972, Blacks were denied cures, and it was let to go through all the different phases of syphilis just for educational purposes. And that hit home in so many different ways, in so many different levels, that it caused a distrust in our community. We're not that far, when you think about it, from slavery time, from our civil rights movements, from our ability to the right to vote, and until even equity in a community in terms of, okay, I'll pay, it's in our education and the resources you see in our community. Like, this systemic racism has been around for so long. So it took a lot of trust, and it's not just our community members trying to relay this information, but it's everybody in this nation having to educate and try to build a trust, a rapport with their people, despite race. And that's the hard thing, because when you go back, and you go back to the 1970s, that's not that far. I was born in the 1970s. And there wasn't just that one incident. There was another incident back in 1951. It was a young lady called Henrietta Lacks. It's a Black woman who had cancer. And some doctors from Johns Hopkins harvested her cells, didn't even tell her she had cancer, didn't tell her they didn't ask her permission to take it. And then they used her cells to reproduce it for cancer research. And they have made millions upon millions of dollars on her cells to this day. This is back in 1951. And I'm not even sure she was compensated for that. She didn't even know, right? So there's things and studies that's out there to show that we have been tested upon without us being knowing it. So we have to heal from those things. Things now, the social action and social injustices or something we have right now, it's so many things happening in our country that we're still hurting. And it's hard for us to heal and trust now. But it's evident, like, we are the highest, where we're talking about, we're in like 10 to 13% of the nation, but you see anywhere between 35 to 50% of people getting this COVID and then being hospitalized, and the highest percentage of dying. And we look at studies, and we did polls just last month. Only 43% of African Americans are willing to take the vaccine, versus 63% and 62% with the whites and the Latinos, and 83% with say English speaking Asians. We're far below from the other tiers who are willing to get the vaccine, but we are at the highest risk above all those. So
wow,
it's the trust factor. It's a dichotomy. Like, you can't win because lack of trust, lack of access to care. What I mean? And then we have all these comorbidities because of the health disparities, and we're dying the most from it. But the one thing that could cure us or help us, decrease symptoms and decrease chance of mortality is a vaccine we don't trust. So
wow.
I just tell people, like, please do your research. Don't follow social media. Go on, like I said, the public health websites, CDC, the WHO. We have people right in our communities. Now, the National Medical Association, which is the largest organization for African American doctors and their patients, are working together in our African American communities with our churches, our civil rights leaders, organizations, and different public officials to try to and like help bring awareness. But we just can't do that ourselves. We as African Americans could like say, hey, we can need to take this vaccine. I have, the first phase 1A, was the frontline workers. I have medical friends who are African Americans, emergency medical doctors who are right there in the front line in New York and in the major big cities across the country, who got their vaccine just on Thursday. We had the first launches of vaccines on Wednesday and Thursday, and we have a lot of first vaccines like the Black nurse. People, the scientists that helped develop the vaccine was an African American woman that graduated from the University of Maryland. There's people right there.
Right
in
here,
Baltimore,
DC area, yeah,
the DMV. You have the NIH, and you have the CDC. You have African American scientists, men and women, who are in the front line trying to discover ways for us to find cures. And then these trials actually looked at all the different various populations. So people was like, oh, they use us as guinea pigs, but no, all races, different age groups were tested with this vaccine. And that's why we could say with the Pfizer vaccine, ages 16 and older could get the vaccine, and with the Moderna, ages 18 and above, because they looked at those age groups, and they also looked at the different racial ethnicities. So as of now, in terms of the safety, we're still looking at that, but the vaccines for both are supposed to be 94% effective. And there are some side effects, but very minor. They
my next question. Are there any known side effects?
As there are, and since not even been a full week yet within the United States, but other countries, the Europe and other developing countries have gotten the vaccines, and they've shown that even in China, it's just like you may get fever, chills, which is a small side effect from that, but you also could have like muscle aches, joint pain. You could also have fatigue, like a lot of symptoms you have when you actually get the virus. You had the same symptoms as well. So headaches, I like to say 55% of people complain of headaches. 63% complain of fatigue. Muscle and joint pain, 38%. And then pain at the injection site is 84%. Most times you get a vaccine, you have pain in that site. And then you always say, do sit-ups, do push-ups or something, like they kind of exercise the arm out, and it goes away in a couple of days. Mm-hmm. There are some cases, very rare, of severe side effects, which are anaphylactic reactions. So people actually have an allergic reaction, and there are other people have like egg, allergies, and can't take certain vaccines that may come from an embryo for development. It's the same thing with the mRNA virus. So some people may be allergic, but you don't know. So that's one thing you have to be, when you get the vaccine, you have to kind of be monitored and make sure you're not in that subset of anaphylaxis. But once you're out of that window, you'll know within the first 30 minutes or so. Most of these symptoms within a few days goes away. I'm
sorry, I didn't mean to cut you off. Go ahead and finish.
Oh, and another side effect is Bell's palsy. Some people, some people face drooping. You think
somebody just mentioned that.
Yeah. Oh, yes, they're right. A few people are getting Bell's palsy. Yes, they have. I know 4 cases that the CDC have just posted that people have gotten Bell's palsy. But we have 4 cases so far. So it's not a lot compared to the millions. We have like 2 million doses going out for Pfizer and 6 million going out for Moderna. So out of 8 million dosages so far, we have 4 cases of Bell's palsy, and we had just a handful of cases of for anaphylactic reaction, which with viruses you do see that typically. So
absolutely.
It's not something out of the norm, and it's very rare. So
you're gonna always have that percentage.
Always you're gonna have those. But the majority of people just have pain at the site. That's it.
Yeah. Doc, I wanna got a lot of questions, so I'm gonna try to get them in before the show is over. So one question from Ms. Verna Johnson, who recently had a transplant about a year ago. She wants to know, what if you already had COVID and the antibodies, should you still take the vaccine?
Yes, Bernard Johnson, as I was mentioning earlier in the talk, that they are telling folks, and I know people who are doctors who are on the front line who got COVID and recovered are still getting the vaccine. So it doesn't matter if you had the virus or not. The antibodies we haven't shown are protective as of yet if you had the vaccine. That's why we if you had the actually infection. That's why we're telling people to get that vaccine. But no, the vaccine is 2 dosages. I know I haven't had a chance to mention that as of yet. So with the Pfizer vaccine, you take 1 dose, and then 21 days later, you take the second dose. And then with Moderna, you take the first dose, and then 28 days later, you get the second dose. And a lot of side effects people are seeing is after they get the second dose. That's what I see it, which that those symptoms just shows that your body's actually mounting an immune response. So that's good. So I wouldn't get alarmed that you had symptoms. It just shows that your body is responding, which is good, because the more it responds, the more of an immune response it has to fight it if you are exposed to the virus in the future.
Wow. Let me ask you, we had a question here. Can this COVID mutate, meaning could next year it could be mutated and you have to take a different vaccine, like with the flu vaccine, each year may be a different mutation? Could that happen with COVID, in your opinion?
As of now, we don't know, right? It's all so new. A coronavirus is different strands of it, right? Different makes of it. So the fact that this can mutate as a virus, viruses mutate. How fast they mutate, we don't know. Like influenza, we know it has major shifts. But in terms of coronavirus, in terms of this particular one, it's still young. Like we're still too new in the system. But that's why we want to do a booster shot. So you get 1 shot, and then it's, we do like with measles and stuff like that. We have booster shots, throughout the course. So after 2 dosages, we'll kind of see, and we may need to get a 3rd shot later on, just to boost our immune system, or a slight different vaccine if it does mutate and shift a little. But that's more to come.
Mm-hmm. Now, how is the vaccine rolled out? Who would be the first to receive the vaccination?
So as of now, yes. So as of now, we have phase 1, and we have 3 different tiers in phase 1, 1A, 1B, and 1C. So in 1A is pretty much our elderly population, so ages 75 and above. So these are people living in long-term care facilities like nursing homes. So these are the people who are the most susceptible to getting the virus, and also our essential frontline healthcare workers. So that's people, right there in the emergency room, people in the ICU, doctors who are taking care of these COVID-19 patients. So that's pretty much with the first rollout. And the second rollout, we call it phase 1B, which you actually, CDC actually just came out a couple of hours ago with the recommendations for this phase out after phase 1, after phase 1A is completed. And these people will be your first responders. So that's like the police force, the firefighters, your EMT, it'll be your teachers, your daycare workers, because I said, again, teachers or children, they're susceptible to that, especially as kids are going to school online, and some schools, students are going back to school. It's important for our teachers to get vaccinated. Our U.S. Postal Service workers, we're just out there in the community delivering mail. We're not sure in terms of transmission, right? So protect them. We need to protect them as well. Public transit workers, so they're in a confined space, in a train or in a bus, in transportation. It's very important for them to get. And people, the essential workers for food supplies, we still have to get food, right? We still have to be able to eat. So we're going to make sure that people who are farmers to the grocery store, so people part of distribution who run a lot of people, or who are, we want to make sure they're not have the virus even transmit it. Even though there has no studies that food it can transmit the virus, we want to make sure there's people who are with us that helping us with our food supplies, that they are well. And then, so that's about 49 million people. But those 49 million people of the 1B phase will not get it until after everyone in 1A gets it. So we don't know. And then we hope that everyone with the 1A by December 31st We hope to have 20 million dosages out so that our first line, most essential workers get it. And then phase 2 and phase 1C of the phases, that's when everybody ages 65 to 74 will get it. People age 16 and higher with underlying health conditions like we talked about. And then the remaining essential workers. So that's the people who are in the healthcare industry, the transportation workers, you have people in IT, the energy sector, banking, your public safety, your media, your justice system, with your lawyers and your judges, people who are out there in the public, for things that keep our society going. Those would be the next phase. And then phase 2 is pretty much like everybody else, right? Age 16. And we're not doing below 16 because research hasn't been justified for that age groups yet. That's why we need the teachers who are around those daycare centers, because adults, as I mentioned, give it to the children. So they make sure that the adults are vaccinated so that we don't give it to our children, because our young children cannot get vaccinated as now. And then, ages 2 and below cannot even wear a mask. So we have to make sure that we protect them. And then pretty much that phase, we do not know when that's going to happen with phase 2, with pretty much the rest of the population, how many levels of phases and breakdown subsets that would occur. But that would be after, phase 1A, phase, 1B and 2. C, and 1C is supposed to be 129 million. So that's pretty much hopefully the majority of the United States. But it's going to be a slow roll as we try to ramp up our dosages.
Wow. Let me ask you, because we're kind of winding down, but let me ask you, Dr. Webster, do you know if for essential workers and people, is this a choice or is it mandatory to take this vaccination?
So because it's emergency use, a lot of institutions are making it highly, highly recommended, but not mandatory. And it really would depend upon where you work, in the civilian sector or within different government agencies. As of now, it has not been, I would say, they're not making people, it's not required, but it's highly, highly, highly recommended to get it.
Mm-hmm. Wow, man.
Because it's not enough, so they can't make it required until it's enough for everybody to make it required. So the people who want to get it, they can get it, and people who are hesitant, they can wait. But it's highly, highly recommended especially if you're essential workers frontline, to get it first.
Or especially if you're dealing with some type of chronic illness or underlying disease, is recommended.
Yes.
Wow.
Highly recommended.
Dr. Webster, as we get ready to close the show, what are your recommendations as a medical doctor and a scientist, and knowing the devastation that this disease had on the minority community? What can you leave with people watching this program tonight about COVID-19 and the minority community? What do you want them to take away from this conversation we had tonight?
That's a great question. And my heart pours out to my community, because we're confused, we're torn, we're not sure. There's a lot of trust issues. So that's why I said, please do your research. Don't go what your neighbor said. Don't worry about what people put on Snapchat, social media, Facebook. Go to these scientific sites. Read for yourself the data. Educate yourself, because read it for yourself so you trust yourself, and discuss this with your healthcare providers. Because if you're a part of the people who have this underlying conditions, who should get the virus, you need to talk to your physician and let them know that, hey, am I a candidate? When can I get it? Do you think I should get this? Because the discussion needs to be made. I don't want people to have so much fear and be confused and not have the right information to make the wrong choice. The choice is yours. No one can make you make this choice. But I would tell everyone to make educated choices and do what's right for you and your family. Please stay healthy.
Wow.
Please stay safe. Please wear your masks. Stay away from, large crowds. I know it's Christmas. We're mourning. We want to be without people, especially when people, are like in my family are dying and you can't even mourn. You can't even see them. Like I wanted to fly up to New York this weekend, but I couldn't because of everything that's going on in the state lines. So we had to celebrate virtually. It hurts, but it's the time. And I'd rather me stay alive and my elderly parents to stay alive and not be selfish and try to transmit something to them when we could just celebrate virtually. I know we want to gather together and we want to hug and kiss each other. I get it, but now is not the time. We had to be due diligence, get through this winter season. It's going to be a long winter, guys. We have to protect ourselves and protect each other.
Oh, absolutely. Wow. Great topic. Great discussion, Dr.
Yeah.
Webster. I really appreciate you taking time out of your busy schedule to come on here on the Sunday night of all nights to share your knowledge and information on the COVID-19. And we hope to have you back in the future at different times where we can discuss other important topics that impact the minority community as a whole and the world as a whole.
Yes, I will appreciate that, Steve, because I'm a big advocate for our people. I'm all about advocacy, holistic healing, and just getting information out there. That's important. And information is key. Knowledge is power. Knowledge is power. So we have to educate and advocate for each other.
No, absolutely. All right, Dr. Webster, I got to get ready to go and host the Lisa Baxter show. I know she's over there waiting for me, but again, thank you so much. Oh yeah. She probably over there waiting, saying, Shondo, come on over and all that.
Shondo, kabase.
Yeah, I love Lisa. Very nice woman. And looking forward to going over here and produce a show. But again, thank you so much. I really appreciate your time because I know time is precious nowadays. And I enjoyed this discussion and look forward to talking to you again.
Yes, sir. Thank you so much. It's a pleasure. It was an honor. Looking forward to working with you again in the future. Stay safe.
All right. You too, Dr. Webster. Take care.
Thank you. God bless.
All right. God bless. Bye-bye. Guys, this was an awesome show. I hope you enjoyed it. I just try to get the information out there like it is, no fillers in it, because that's what you want to know. You want to cut down to the chase and want to know what you need to know. Just like with nursing school, at the end of the semester, when we go study for the test, instead of using all those thick nursing books to filter through to find information, we buy a Mosby NCLEX book to just give you only what you need to know, just like Liberty Mutual. And this is not endorsing them, but we're only giving you what you need to know and taking out all the fillers. So with that being said, we got a lot of people who commented, and unfortunately, I set this show up right before the Lisa Baxter show, and I just knew this was going to happen. But for respect for Lisa's show, got to get prepared for this. I'm sorry I couldn't get to all the questions, but I just like to acknowledge everyone who watched this show tonight. Richard Knight from AAKP, Manaya Salam, Frenchie, Kevin, Miss Betty, Donnie, Leslie, Will, Miss